Sleeping this way. Dr. Mark explains hidden stroke risk at night. Picture this. It's 3 in the morning. The house is silent. Your body is supposedly resting, recovering, healing. But for nearly 1 in 5 stroke patients, that exact moment, the quiet hours of sleep, is when the stroke happens. No warning, no ambulance siren, no one watching. Just silence, and then a life changed forever. I'm Dr. Mark, and over the years in clinical practice, I've sat across from patients who told me the same chilling story. I went to bed completely fine. I woke up and couldn't move my arm. Or worse, family members who say, "We thought he was just sleeping in. He never woke up the same again." Today, I want to talk about something most people never think about: the hidden link between how you sleep, what happens in your body while you sleep, and your risk of having a stroke during those very hours when you're supposed to be safest. We're going to talk about sleep position, snoring, sleep apnea, blood pressure changes at night, and the warning signs that family members and caregivers absolutely need to know. By the end of this video, you'll understand why that pillow, that mattress, and that nightly routine might be doing more to your brain and heart than you ever imagined. If you or someone you love snores loudly, gasps for air at night, wakes up with headaches, or just doesn't sleep well, stay with me. This could genuinely be one of the most important videos you watch this year. Let's get into it. Let's start with something most people don't realize. Stroke isn't just a daytime event that happens because someone got stressed at work or skipped their blood pressure medication. A significant number of strokes, often called wake-up strokes, happen during sleep or are discovered the moment someone wakes up. Studies suggest that roughly 1 in 5 ischemic strokes occur this way, as a wake-up stroke. Think about that for a moment. That means for a large portion of stroke patients, there was no chance to call for help in the moment it mattered most, because they were unconscious, asleep, completely unaware of what was happening inside their own brain. So why does this happen at night? Why would the body, which is supposed to be in rest and repair mode, suddenly become more vulnerable to one of the most devastating medical emergencies there is? Here's the first piece of the puzzle, and it's something I explain to almost every patient who comes in with high blood pressure. Normally, your blood pressure should drop during sleep. We call this nocturnal dipping. It's actually a healthy sign, your cardiovascular system getting a break overnight. But in many people, especially those with poor sleep quality, sleep apnea, or chronic insomnia, this dipping doesn't happen properly. Instead, blood pressure can spike at night or surge dramatically right around the time of waking up. That blood pressure pattern, the failure to dip combined with a sharp morning surge, is one of the key reasons strokes cluster in those early waking hours. Now imagine this scenario. A 58-year-old man, let's call him Robert, has been told for years that his blood pressure is a little high, but manageable. He snores heavily, his wife jokes that he sounds like a freight train, and some nights she even hears him gasp or stop breathing for a few seconds. He brushes it off. "I'm just a heavy sleeper," he says. What Robert doesn't know is that every single one of those pauses in breathing is putting enormous strain on his heart and blood vessels. His oxygen levels are dropping, his blood pressure is spiking, and his brain's blood vessels are being hammered night after night, year after year. This is not just snoring. This could be obstructive sleep apnea, and it is one of the most underdiagnosed stroke risk factors in modern medicine. Let's talk numbers for a second, because I think this is where people start to really understand the seriousness. Obstructive sleep apnea is recognized as an independent risk factor for stroke, and people with moderate to severe cases face a meaningfully elevated risk. And here's the part that genuinely concerns me as a physician. Estimates suggest that as many as 80% of people with obstructive sleep apnea have never been diagnosed. 80%. That means the vast majority of people walking around with this condition, people who might be your spouse, your parent, your co-worker, have absolutely no idea their nighttime breathing is putting them on a path toward a potential stroke. Now, let's talk about sleep position, because this is the part that gets people's attention, and rightfully so. Many people ask me, Dr. Mark, is there a sleep position that causes strokes? The honest answer is more nuanced than a simple yes or no, but it matters more than you think. Here's the connection. When you lie flat on your back, gravity pulls the soft tissues of your throat, your tongue, your soft palate backward, and that can partially or fully block your airway, especially in people who already have sleep apnea. This is why so many people who sleep on their backs snore loudly, and why their snoring often gets dramatically worse or even silent with pauses the longer they stay in that position. Side sleeping, on the other hand, tends to support steadier airflow, particularly for people whose breathing problems are worse when lying flat. I want you to think of it like a garden hose. If you lay a garden hose flat on the ground and then place a heavy object on top of it, water struggles to get through. It gets restricted, maybe even stops completely for a moment. But if you reposition that hose so nothing is pressing on it, the water flows freely. Your airway works in a similar way. Sleep position can be the difference between a pressed hose and a free-flowing hose. And over months and years, those repeated restrictions take a toll on your cardiovascular system. Now, I do want to be careful here, because as a doctor, I never want to oversimplify. The strongest evidence we have points toward treating the underlying breathing disorder itself, rather than relying on sleep position alone as a stroke prevention strategy. In other words, switching from back sleeping to side sleeping isn't a magic stroke-proof switch. But for people whose breathing problems are noticeably worse on their backs, changing position can meaningfully reduce the nightly strain on their heart and brain. And when you combine better sleep position with proper diagnosis and treatment of sleep apnea, that's when we start to see real, measurable improvements in cardiovascular risk. Let's bring in another patient's story, because I think these examples really help this information stick. Linda, 64 years old, came to see me because her daughter was worried. Linda had been more forgetful lately, waking up most mornings with a dull headache and feeling exhausted no matter how many hours she slept. Linda herself thought, "I'm just getting older. This is normal." But when we dug deeper, it turned out Linda had been diagnosed with mild hypertension years earlier and had also been a chronic insomniac for over a decade, sometimes sleeping only 4 or 5 hours a night, often waking up multiple times. Here's what's important about Linda's case. Large studies looking at sleep patterns and stroke have found that both very short and very long sleep duration, poor sleep quality, symptoms of sleep apnea like snoring, snorting, and breathing pauses, and excessive napping are all linked to a higher chance of stroke. And this wasn't just a small effect. The relationship was additive, meaning the more of these sleep problems someone had stacking up together, the higher their odds of stroke became. And this pattern held for both major types of stroke. This is why I tell my patients, sleep isn't just about feeling rested the next day. Sleep is one of the most powerful and most overlooked regulators of your blood pressure, your blood sugar, your inflammation levels, and ultimately your brain health. Let's also talk about insomnia specifically, because I think this gets dismissed far too often as just stress or just getting older. One major study found that people with 5 to 8 insomnia symptoms had roughly a 50% higher chance of having a stroke compared to those with no insomnia symptoms at all, even after researchers accounted for other risk factors. Even people with just 1 to 4 insomnia symptoms had a noticeably higher risk. The researchers behind that study explained it simply, noting that poor sleep can disrupt the natural overnight dip in blood pressure and contribute to hypertension, which is itself a major driver of stroke risk. So when your friend or family member says, "I just can't sleep, I lay awake for hours," please don't brush that off as a minor inconvenience. That pattern, repeated night after night, may be quietly raising their stroke risk in a very measurable way. Now, let's talk about the warning signs. This is the part I really want caregivers, spouses, and adult children to pay close attention to. because recognizing a stroke that happens during sleep or right upon waking can be incredibly difficult. The person isn't awake to tell you something feels wrong, which makes these next few signs absolutely critical to know in advance. Here's what I tell my patients' families to look for the moment someone wakes up. Did they wake up with a sudden, severe headache that feels different from any headache they've had before? Are they confused, having trouble speaking, or struggling to find words? Other warning signs include waking with vision changes, dizziness, or sudden weakness on one side of the body. Is one side of their face drooping? Can they lift both arms evenly, or does one arm drift downward? Is their speech slurred? I want you to remember the acronym FAST. Face drooping, arm weakness, speech difficulty, time to call emergency services. If someone wakes up with any of these symptoms, even if they seem to get better after a few minutes, do not wait. Do not say, let's see how they feel after breakfast. Every single minute matters when it comes to brain tissue. Let's also talk about the daytime clues that something might be brewing at night. If you experience loud snoring, gasping during sleep, excessive daytime sleepiness, or persistent morning headaches, these can all be signs of an underlying sleep disorder that raises stroke risk, and they deserve a real medical evaluation. I cannot stress this enough. So many people think, I'm just tired because I have a busy life. But chronic, unexplained daytime exhaustion combined with nighttime snoring or witnessed breathing pauses is a pattern that deserves a real conversation with your doctor, not just another cup of coffee. Now, let's talk about what you can actually do, because I never want to leave you with fear and no direction. Fear without action helps no one. Action, even small action, changes outcomes. First, if you or your partner snore loudly or have witnessed pauses in breathing, talk to your doctor about a sleep study. Effective treatment for sleep apnea, including devices that keep your airway open overnight, has been shown to meaningfully reduce the strain placed on your heart and brain. This single step, getting properly diagnosed and treated, may be one of the most impactful things you do for your long-term brain health. Second, consider your sleep position, especially if you've noticed your snoring is worse on your back. If you're trying to retrain yourself to sleep on your side instead of your back, a body pillow can help, along with making small adjustments night by night, rather than forcing an overnight change. Some people have even used the old trick of sewing a tennis ball into the back of a pajama top to discourage rolling onto their back. It sounds almost silly, but I've had patients tell me it genuinely worked for them. Third, if reflux is an issue for you, especially waking up with a sour taste or burning in your throat, elevating the head of your bed by roughly 6 to 8 inches using a wedge or adjustable frame can help reduce nighttime reflux while keeping your spine properly aligned. Fourth, prioritize consistent sleep duration. Both too little and too much sleep have been linked to higher stroke risk, and for most adults, somewhere between 7 and 9 hours per night appears to be the sweet spot. I know life gets busy. I know there are nights when sleep feels like the first thing to sacrifice, but your brain's blood vessels don't get a vacation just because your schedule is hectic. And finally, if you are someone who lies awake for hours, who wakes up multiple times a night, who feels like your sleep just isn't restorative no matter what you try, please don't normalize that. Talk to your doctor. These sleep issues are exactly the kind of modifiable target that real stroke prevention is built on, meaning these are things we can actually do something about, not just risk factors we have to passively accept. Before we wrap up, I want to leave you with one more image, because I think it captures everything we've talked about today. Imagine your cardiovascular system as a hard-working night shift crew. Every night, while you sleep, this crew is supposed to ease off, lower the pressure, let the pipes relax, do some quiet maintenance on your blood vessels and brain. But if your airway is blocked repeatedly throughout the night, if your blood pressure never properly dips, if your sleep is constantly fragmented, that night shift crew never gets to rest either. They're working overtime, under pressure, night after night, for years. Eventually, something gives, and too often, that something is a stroke. So, here's what I want you to take away from today. The way you sleep, the quality of your sleep, and the silent symptoms happening while you're unconscious are not small details. They are some of the most powerful and most fixable pieces of your stroke risk puzzle. If anything I described today sounded familiar, the snoring, the gasping, the morning headaches, the restless nights, please don't wait for a someday appointment. Bring it up with your doctor. Ask about a sleep evaluation. Talk to your family about the warning signs of stroke, because being prepared could one day mean the difference between a close call and a tragedy. I'm Dr. Mark, and I want you to remember this. You can't always control what happens while you're asleep, but you absolutely can control what happens before you close your eyes tonight, and what you do tomorrow morning to get answers. Take care of that night shift crew working inside you. Your brain, your heart, and the people who love you are counting on it. Stay safe, sleep smart, and I'll see you in the next one.